Okay. So, let's get going this. I'm going to wear my coat and act like I'm professional.
Whoa, look at you.
Okay, so atypical bacterial infections is a huge problem here in the United States. Whether they know it or not, the American Heart Association has been non-accepting of the fact that heart disease is caused by fear, lack of love, many emotions, and it's affecting our heart and cardiovascular system. It's the flow of the body, the flow of oxygen, the flow of nutrients. Everything is basically, when you go into fear, it stops the flow of everything. And we're living in a very fear-based society, and so it's real important to know how important it is to live by faith instead of fear, which is, you know, very basic, but I believe in it totally. The emotional processes affect all the energy levels, centers in a negative way. The heart and cardiovascular system are an amazing system. They help the flow of energy within the body, and the heart is also the center of energy in the body, and everything is processed through the heart. And so that's why it's so important to keep the heart, the thymus, and the lungs healthy. And it's interesting because these atypical bacteria cause huge problems with the cardiovascular system, the heart, the thymus, and the lungs. They enter the body through food, air, water, and settle into the circulatory system. Atypical bacteria attach to the intima of the blood vessels, which is the inner layer, and it causes inflammation. It leads to injury of the blood vessels, plaque, and reduction of the surface area, leading to blockage and/or stroke, heart attack, and organ damage. So it's the beginning of problems with most of the body. Bacterial infections, there's several types of bacterial infections, and we get them through our food, air, water, getting coughed on from other people, kissing other people, sexual intercourse, all kinds of ways. And the ones I'm going to talk about particularly are the mycoplasma, the chlamydia, the ureaplasma. Strep and staph also cause severe bacterial infections that affect the circulatory system. Helicobacter pylori is another atypical infection, and it can get into the lungs through acid reflux, and literally a lot of people will wake up, they'll have a sore throat, their lungs are hurting, and it's due to the Helicobacter pylori getting put into the lungs, and it goes into the heart and causes the same problems mycoplasma, ureaplasma, strep, staph, chlamydia can cause. Atypical pneumonia is associated with heart disease. This past week, an article from the European Journal of Preventive Cardiology, they found that chlamydia pneumoniae antibody levels to calcium levels within the coronary arteries in 2,000 adults, which is a pretty good study, large study. They were followed over 3 years, and 76% were positive for antibodies to chlamydia pneumoniae, which causes atypical pneumonia. And they found those with these antibodies build up 20% more plaque than the other people who did not have the antibodies, and so it caused acceleration of cardiovascular disease. Okay, and it builds on research showing a link between this bacteria, and this is just one of many, and coronary artery disease. And how it works is it increases the binding of the white blood cells, the macrophages, to the endothelial cells, which is the intima layer of the blood vessels, And this binding leads to damage and plaque buildup. And so it's definitely associated, and more studies are coming out finding this. I'm going to talk about vitamin D because a lot of people go, oh, how come everybody's all of a sudden checking vitamin D levels? And we're going to talk about that because vitamin D protects the endothelial cells lining the blood vessels and reducing inflammation that can cause damage to the blood vessels. It increases nitric oxide, which lowers blood pressure and increases the blood flow, and other chemicals which help relax the blood vessels, and it reduces the damaging oxygen metabolites, the free radicals. Interesting thing also is vascular smooth muscle cells line the blood vessels, and they grow and migrate into the inner wall when you have arteriosclerosis. And vitamin D blocks this cell growth and migration, so it keeps the blood cells where they're supposed to be and keeps the blood vessels strong. It also improves relaxation of these smooth muscle cells and aids in repair. And this is interesting how it always pops up an update when I'm giving a talk. Maybe it's trying to tell me something. Vitamin D has been shown to help telomerase and stops DNA from unwinding in these cells. Clotting within blood vessels is also decreased by vitamin D, so it prevents stroke. The immune cells, the white blood cells, are affected by vitamin D in patients who are taking vitamin D, who are deficient in it. There is an excess of chemical released from white blood cells that causes inflammation and clotting. Interferon, tumor necrosis factor, interleukin-6, and other interleukins. Variety of other blood vessel protecting effects of vitamin D include insulin sensitivity. If you're taking adequate vitamin D, your insulin works better, so you don't get such high blood sugar levels, which actually damage blood vessels and cause toxic metabolites. The vitamin D deficiency is associated with higher total cholesterol levels. And let me tell you why. They don't ever say why in these studies. And the reason why is when you're low on vitamin D, the liver senses that you're low on vitamin D, so it produces more cholesterol. And in hopes that that cholesterol will go to the skin and get hit with the sun and make vitamin D out of the cholesterol. Believe it or not, we make vitamin D out of cholesterol. And when you're low on vitamin D, your body increases cholesterol. So a treatment for high cholesterol isn't the statins, it's taking vitamin D. So vitamin D also suppresses renin and other chemicals that lead to hypertension. And administration of vitamin D in those who are deficient increases good cholesterol and decreases triglycerides. So vitamin D has very good effects and no bad effects. Now there's also studies that show when you have adequate D3, vitamin D3, which is the best, most effective vitamin D, and vitamin K2, it actually helps prevent heart disease and blood vessel damage, as it directs the calcium that vitamin D3 helps you absorb go to the bones in your skeleton and make it not accumulate in your blood vessels, causing hardening of the arteries. So taking vitamin D3 with K2 helps soften blood vessels and makes them better. Now I put the word coumadin here because what does coumadin do? It decreases the effectiveness of vitamin K. So when you're taking coumadin, it actually causes you to accelerate in damage to the blood vessels. And yet medical doctors put people on coumadin every day and they don't even think about it. Coumadin and vitamin K, blood clots are formed through a series of chemical reactions in your body. Vitamin K is essential for those reactions to form blood clots. And coumadin works by decreasing the activity of vitamin K. In fact, vitamin K is the antidote to coumadin. So it's interesting how they'll put us on Coumadin and it accelerates heart disease. There's two types of vitamin K. One is called phyloquinone, and it's found in the green vegetables, you know, the doctors don't want you to eat. It goes directly to your liver and helps you maintain a healthy blood clotting system. And this is the kind of vitamin K that infants are given at birth to prevent bleeding disorders. They give them a shot of vitamin K1. Vitamin K1 also keeps your blood vessels from calcifying by working with vitamin D, and it takes the calcium out of your blood vessels, puts it into the bones. And you know how most of the women and men now are getting problems with osteoporosis, you know, osteopenia, too little calcium, phosphorus, magnesium in the bones. And by giving people Coumadin, you actually accelerate this process of losing minerals from your bones. Vitamin K1 also goes in our healthy kidneys and is converted into K2, which is even more powerful and a better type of vitamin. However, a lot of our kidneys are they have problems and they're damaged because of our modern lifestyle. Our kidneys are failing at an accelerated rate, and our kidneys are unable to convert it to K2. Okay, let's talk about vitamin K2, menaquinone. Good bacteria in the gut convert K1 in the vegetables to K2, but we don't absorb it very well. And a lot of those things are due to statins and getting abnormal genetically modified foods in the gut, altering the good bacteria so they don't produce the vitamin K2. In the studies I read on the internet, they didn't even make a note of that. But a lot of the problem is the bad bacteria are getting more prevalent in our guts, and so we're not producing K2 in our gut. And the K2 protects blood vessel walls, the bones, and the tissues, and it's also present in fermented foods, particularly cheese and the Japanese food natto, which they make natto kinase from, which actually helps dissolve blood clots. Vitamin K2, they found, actually helps dissolve blood clots, which is by far, you know, when you think about it, our kidneys aren't able to convert it anymore, and our bacteria has changed, so we're getting lower and lower levels of K2. Now, Systemic Formulas came out with a product that is called vitamin D3 plus K2. And I want to talk about this just a little bit because this is an amazing product. Not only do they have vitamin D3 and vitamin K2 in here, but they have herbs that help you absorb it. So get it into your body and get it into your cells and have it work. So this product actually lowers blood pressure, lowers cholesterol in the body, helps the blood flow better, helps the blood vessels be stronger, and is an amazing product. So we have a lot of people on this because, you know, our modern diet keeps us from getting enough K2 and vitamin D3. One of the reasons, well, we'll go into this further, but liver disease and heart disease. A healthy liver takes vitamin D1, cholecalciferol, from the skin. So cholesterol and sunlight gives you D1, and then the liver takes and adds a group to it and makes D2, or ergocalciferol. It's also called calcidiol because it's D2, so diol is the 2. And then it's converted in the kidneys to calcitriol, or the biological active form of D3. So it gets more active as the liver converts it, and then it goes to the kidneys and converts. But with all of the diabetes and diseases and atypical bacteria, it actually makes the liver unhealthy, so we don't make and convert the D1 into D2, and our kidneys are suffering, so we don't make it into D3. So that's why it's so important to take a supplement, because we're just not making it in our body because of all the changed bacteria, all of the problems with our kidney and liver. And so it's interesting because the D3 helps regulate the concentration of calcium and phosphate in the bloodstream, and it promotes the healthy growth and remodeling of bone. Now, all of us are having bone problems, so the calcitriol and the cholecalciferol D3 affects neuromuscular and immune function. It actually helps our immune system work better, our thymus work better, helps get rid of infections within the body, and it helps with this atypical bacterial infections in our system that cause heart disease. So quite involved. Okay, about 4 years ago, I had a lady call me up, and she said, "My husband is dying. I love him so much. Is there anything you can do for him?" And I tuned into his body, and I got that he had arteritis vasculitis due to atypical bacteria that was literally killing his whole body. It was causing inflammation. He was about ready to have a stroke. His blood pressure was up. All kinds of stuff was going on. The doctors just said, "Oh, you're going to die," because they didn't know what to do for him. And when this lady called, I got really strong. He had an arteritis vasculitis due to atypical bacteria. Now, the inflammation caused by this causes partial or complete blockage of the blood vessels, narrowing of the blood vessels, and weakening of the walls of the blood vessels, which can cause the blood vessels to balloon out. And when they do that in the brain, they call them aneurysms. They can do it in the aorta. They call them abdominal aortic aneurysm. This guy actually had one of those developing when I started treating him. And they cause the aortic aneurysm that happens in the chest, which breaks down and makes that balloon up, and eventually people die from that. So the blood clots are real common, and it increases CRP, which is the C-reactive protein. Now there's a subcategory called the cardio C-reactive protein, and they do a lot of blood testing for this now, but they just call it an inflammatory level. It tells people, "Oh, you got inflammation." Well, duh. The inflammation is due from the infection that's in these blood vessels. And mycoplasma, chlamydia, ureaplasma, staph and strep can cause these to go up. Mainly the mycoplasma, chlamydia, ureaplasma causes CRP to go up, the C-reactive protein. And cardiologists will do a fraction of that called the cardio C-reactive protein. And if that's high, they say you have heart disease, and guess where they send you? Instead of treating you medically, they send you to the cardiovascular surgeons to do what? To do surgery on you. And the only blood vessels they usually treat are the ones in the heart. But the blood vessels are bad in the brain, they're bad in the kidneys, they're bad all over the body. And so they give them maybe an extra 5 to 10 years by doing $120,000 plus surgery. Now, when I was training in St. Louis, Missouri, I did a general surgery rotation with one of the first cardiovascular surgeons in the country. And as we were harvesting the vein in the leg, I was doing the harvesting in the leg, and I was going to hand this piece to him so he could put it in the heart. He told me a story that happened in the 1960s. And they actually did a huge study there in St. Louis on the benefits of cardiovascular surgery versus medical treatment, which back then they used doxycycline, which treated atypical infections. They found that the medical treatment was as effective without the, they call it comorbidity, which is complications of surgery. So the medical treatment was actually better than the cardiovascular surgery. And they suppressed the information from that study because the American Society of Cardiovascular Surgeons was so powerful that they directed everybody to go to surgery rather than medical treatment, which I found fascinating. But this was discussed, during surgery, and I never heard a word about it, and I researched it and couldn't find much about it, but this guy knew about it because he was one of the people who did the study. So, what does that all mean? What it means is medical treatment of infections is actually better than surgery for heart disease. Now, what I found is herbals are even better because they don't have the side effects of the antibiotics, which drive more fungus into your body. And I found a lot of people with congestive heart failure have fungus in their heart, which causes a weakening of the heart, which is what describes what that problem is with the heart. Congestive heart failure is just the heart doesn't have enough energy to pump. And I found getting rid of fungus helps the heart get energy back and gets rid of the fungus in the heart. So anyway, let's talk a little bit about the arteritis vasculitis. First stage is obviously an infectious type cause. People describe getting sinus infection, a cough, bronchial infection, intestinal infection, fatigue, malaise. Malaise is just another, you're just too tired to do anything, which is fatigue. Body aches, muscle aches, joint pain, headache, skin rash, fever, and they can have some weight loss during that period because your body's trying to fight this infection. It demonstrates an infectious cause with virus and/or atypical bacteria, and you can have regular bacteria. Now, the interesting thing about atypical bacteria is they can't live outside of the cell. So they infect and get into the cells and cause problems, just like a virus. But they're called atypical bacteria because they actually have characteristics of bacteria. Now, the second stage is known as the vascular inflammatory stage, which causes pain in the extremities and joints, arm numbness, blurring, double vision, headaches, shortness of breath, high blood pressure, all the things that we've been talking about. These symptoms occur because of reduced blood supply to the affected area due to inflammation caused by the infection. Occasionally, the first and second stage symptoms occur together. So it can start out as a respiratory infection, and all of a sudden you've got, vasculitis, arteritis throughout your body. And it definitely demonstrates an infectious cause. And additional bugs usually get in because these people go to their doctors, their medical doctors, with a cold, sinus, the first stage, and they give them antibiotics. And what happens when we get antibiotics? Fungus takes over. So in this stage, the second stage, you actually get fungus, and you still have these atypical bacteria because the antibiotics they give you don't treat the atypical infection. A lot of people will end up getting blood clots in this stage in their legs or in their lungs or in their brain even, and it can be pretty scary. So what do? They put you on blood thinners in the second stage. So it's interesting. And the blood thinners cause what? The K2 not to work, which actually would help remove this, keep it from getting worse. Okay, so the third stage, you usually get chronic hypertension. Doctors will put you on blood pressure pills. It can cause stroke, heart disease, continuing damage to the blood vessels, hardening of the arteries. Definitely demonstrates an infectious cause with the viruses, bacteria, in the intima lining of the large blood vessels. It makes them weak. This guy in New York, he literally was forming an aortic aneurysm, and it can lead to failure of your organs because of lack of blood flow, usually the kidneys, and subsequent death. So, What's the treatment? With this guy, it was really interesting. Money was not a problem with him. He was rich and had plenty of money. They live on a lake in New York, and his wife says, I'll get whatever he needs. Money is not, anything that you should worry about. And so I put him on a treatment plan that, I just treated him with everything that would help him get better. And so we used nattokinase, which can be expensive. Natto, notice the name natto, that produces a lot of vitamin K2. Natto does. It reduces the plaque and dissolves the fibrin clots. And then the serrapeptase, which is another they call these internal enzymes because they go into the body. They're actually absorbed and they do things in the body. Most enzymes will stay in the gut, digest your food, do those kind of things. But these two are internal enzymes, and you have to use them in fairly high dose. And this you use 20,000 units 3 times a day. And the serrapeptase actually reduces the scar tissue. So it repairs these problems within the blood vessels and the organs for that matter. So these two are very important in the treatment. The other things, that's an interesting slide. What I found too is taking the number 3 Bactrex, which is an antibacterial, kills the bad bacteria. Number 4 helps kill the fungus. This combination actually will kill strep and staph. And then you add the stabilizer because this helps get this atypical bacteria and virus out of your cells. The number 5 stabilizer does that. So this combination treats the infectious cause. Now, the other treatment, they found that fruit extracts, and we used to have one called Very Berry, and they quit making it. Solvay made it. It was a great product, tested really good, and I actually started this guy on the Very Berry, and it had all of the different berries which actually help the body get rid of atypical bacterial infections and viruses. And so these fruits, especially the berries, are so important. Then the grapeseed extract, which is actually an extract that, they take the seeds of the grapes, and most of our grapes are seedless now, so they don't even have seeds, but they crush them down and they get this extract from the seeds, and it aids with the repair of blood vessels. Now, when I was first treating fibromyalgia and those type of things, grapeseed extract helped get rid of virus too. And pine bark extract helps get rid of the virus and those kind of things. The vitamin D and K2, that's this, a half a dropper 3 times a day, helps with the repair of the blood vessels. Also helps lower your cholesterol, helps the blood flow better, and helps repair the organs. They found L-citrulline, which is an amino acid, and you take 750 milligrams three times a day. It aids with the repair of the blood vessels. It's actually an amino acid that helps soften the hardening of the arteries. It helps rebuild the intima. The intima is the inside level of the blood vessels. They've also found the L-citrulline is very good for the smooth muscle and helps dilate it and soften it, and helps that work better. Resveratrol. They actually did a recent study where they went in with 1,000 milligrams a day, and I've only put people on 200 milligrams. But when they put people on 1,000 milligrams, they found it reverses cardiovascular disease. And all of the studies, that say the Mediterranean diet, especially the French drinking their wine, this resveratrol is very high in red, dark wines. And so that's why a lot of the French don't get cardiovascular disease, because they're getting this resveratrol in their diet. And I recommend to people to take it because it's very powerful. It's called a superfood, and so very good for rebuilding the body and making you younger. Okay, the other treatments that I put this guy on, as you can see, there was several pages of treatments. And he would take this religiously. His wife gave it to him, and he'd take it. Anyway, magnesium citrate. Now the citrate binds with the magnesium, and I like the magnesium citrate because the citrate goes into vitamin C in the body. And it also helps the magnesium go in and replace calcium and soften the blood vessels. Magnesium is the great softener. If you've got hardening of anything in your body, even hard stools, magnesium will loosen those up and make them softer. And it works for softening the intima of the blood vessels, plus making your stool softer. You're not straining to go to the bathroom, because when people are in the bathroom, they found most people, if they have a real hard straining bowel movement in the mornings, causes heart attacks, causes aneurysms to rupture, because they're straining and putting pressure on their cardiovascular system, and when it's been weakened, it can pop the blood vessels. The other thing is vitamin C with bioflavonoids, and you want a combination that has 500 milligrams of each, the vitamin C and the bioflavonoids. Bioflavonoids are an interesting nutrient. They are very powerful for repairing blood vessels. And the vitamin C, when I used to give people vitamin C in IV chelation, the vitamin C helps in every aspect of the repair process. So it's important to get adequate vitamin C. And I would give people 2, so 1,000 milligrams, morning, lunch, and dinner. Now, another effect of the vitamin C with the bioflavonoids, it makes your bowel movements much easier too. So the magnesium, the vitamin C with the bioflavonoids helps with bowel movements. And they actually found people who are constipated have higher incidence of blood vessel disease and heart attacks. So, rutin. Rutin is a B vitamin, and it's lacking in most B vitamin preparations, or it is too little to do enough. And rutin has been shown to repair the blood vessels. And so I use a lot of rutin and 500 milligrams twice a day. Astaxanthin. I started, actually this man in New York, within a month he was feeling so good he was able to get out of his deathbed. Within 3 months his doctors were amazed that he was even doing what he did, and he started going back to work. 84 years old. This guy is interesting. He consults, and he wasn't even able to consult because he was in his deathbed. But anyway, he started consulting in 3 months, and here it is 4 years later. He's 88 years old. He's alive and well and happy as could be. But what's funny is he had a little bit of a relapse, and so he got right back on this program, and he's feeling great again. He actually got to the second stage where he got a blood clot in his leg, and his wife called me up, and I talked with her and him, and they decided to continue with this regime. It's a very good regime, and we've had a lot of fun. But the astaxanthin is an interesting product. Fish oil. The difference between regular fish oils and salmon oil is astaxanthin. And astaxanthin is what makes salmon's oil pink. And they found salmon oil doesn't go rancid because of the astaxanthin. Why? Because what makes the oil go rancid is bacteria gets in, or fungus. And astaxanthin fights bacteria and fungus. So I added this to the regime about a year ago just because this also fights atypical bacteria and fungal infections. And it's very good. They found it's very good for the blood vessels. So. And then Ultra B12. The reason I have people take Ultra B12 is it doesn't just have B12. B12 is a very good methyl donor. And our liver has glutathione, and in order for glutathione to be active, it has to be methylated. And glutathione is what detoxes our body. It helps get toxins out of the body. And Ultra B12 helps glutathione do its job, because it'll take and attach to a toxin and drop the methyl, and the methyl group will be taken out of our body through the stool, but also the toxin is taken out. But then the glutathione is not methylated, so it either gets removed from the body, or if we're taking B12 or we've got good bacteria producing B12 and other B vitamins, it will remethylate, be reabsorbed in the body, go back to the liver and get another toxin and go through that process of cycling out toxins. So Ultra B12 has all of the good B vitamins and a lot of B12 in 3 different forms: the methyl, the cyano, and there's another that's really good and helps keep the liver cleaned out. But also B vitamins are very good for repairing blood vessels and repairing the nerves that get damaged too. So it's quite interesting. So here we've got the number 3 and number 5, and I always use number 4 too now because we have a lot of fungus in our bodies. ABC just means Acidophilus, Bacillus, coliforms, the good bacteria. Get those back in if you got a real severe infection. Systemic Formulas makes this product called Gold that's really good with people who are really sick. EV is Elixir Vita. Imperial Attacker, these have herbs in that help fight infections, helping your colon, helping your digestion, helping your liver, helping your pancreas, and your spleen. The spleen cleans the blood of infections. And so a lot of times I'll find people have problems with their spleen. And I even had a major problem with my spleen, and luckily I got that cleared up this last month. So my spleen's not hurting anymore, which is good. I can lay on my left side again. Using NC Calm, N3, which is something to help regrow the nerves, and N for nerves. Another good product that isn't on here is lion's mane. We were talking about this just earlier. Lion's mane has a couple of properties. Number one, it's a really good antifungal and gets fungus out of the nervous system, and then it has nerve tissue growth factor. It's one of the few things on the planet that has this, and it helps stimulate the production of new nerves. Now in medical school I was taught, you know, if your nerves go bad, you can't repair them. You know, if you have a stroke or you get Alzheimer's, you get these nervous conditions that cause degeneration of the nervous system, there's nothing you can do. But guess what? I found with lion's mane you can repair the nervous system, which is way cool.
Do you carry that?
Yes, yes. We have it in a couple of different products. There's one called lion's mane, and there's another. This is the same company, by the way. It's called Mushroom Wisdom, and they make a product called Super Lion's Mane. And then they made one called Amloban, which actually has the extract that helps get rid of fungus and repair the nerves in people with Alzheimer's. Because amylo, you know, they call them amyloid plaques. Amylo is fungal, like plaques, if you look at the definition. And this is the extract called 3399 from lion's mane, so it's the extract. This actually brought my mom back good enough so she can go to the store, not get lost anymore. I mean, she had a real severe case of Alzheimer's. And my one sister wanted to put her in a home, and I knew that my mom would probably be dead within 6 months if she got taken out of her home. And so I insisted that she take this. My sister was fighting tooth and nail because she's very medically oriented. She wanted her to go on these stupid drugs that don't work for Alzheimer's. And I insisted she take this, and my dad agreed, and she started taking it, and she's functional. My dad's really happy because he doesn't have to worry about her wandering off anymore. So it's interesting that this product. Another good product for the brain with loss of function is this one called Prevagen. They actually found it's called a jellyfish, you know, like out in the ocean, and they got an extract from the tentacles. It was actually a interesting extract, And they found this extract actually helped stimulate the brain and regrowth of brain cells. So kind of another interesting product that has nothing to do with this topic, but maybe it does. Because it does regenerate the nerves, and these bacterial infections can cause damage to the nerves. So those are the products that really help with that. A lot of these other products, like the EE oil, helps with emotional issues, believe it or not. EE oil is Essene essence oil. The Essenes were the people back in the time of Jesus, who actually Jesus was one of them. Joseph and Mary adhered to the philosophies of the Essenes, who were a group of very spiritual people who lived very close to the land, close to spirit, close to God. And but this Essene oil was an oil that they used to help protect themselves and remove negative emotions, which is fascinating. So you just sniff this oil and it helps get rid of negative emotions. This product, also made by Systemics, DIJS, they call it Acides, but it restores the circadian cycle in the body. A lot of us, you know, in modern society will work odd hours, will be up all night, and it messes up our whole cycling of our organ system. And this actually helps restore that circadian rhythm and helps the digestive system, the nervous system, all of the different organs and glands get back on a better rhythm. This DSIR Energen supports rebuilding of the tissues of the stomach, the duodenum, the thymus, which is very important for the immune system, and it's very powerful. These products are AO is aloe vera. The number 2 helps rebuild the gut, and the number 6 helps restore function to the glands and the other things. So that's the end. You know, it's interesting. Saint Germain came to me again on Saturday. I know this sounds weird, but he told me I need to start giving out the formula for the Elixir of Eternal Life. And what's really interesting, it includes resveratrol, which is really good for the blood vessels, and acai berry. But it's quite high dose, and you also take it with radishes, celery, and beets, carrots, and radishes. And it's very powerful for restoring the immune system. And it was interesting, Angela went on a thing with us, and Sylvia Brown talked about how if we are going to survive in the 21st century, we've got to have strong immune systems. And so this Elixir of Eternal Life basically strengthens your immune system. It was fascinating because we were researching celery, and celery is very good for your bones. It's good for your nervous system. You know, it has minerals in it. It's just one of these really good vegetables, and it's a part of it too. So I'll copy off some of this Elixir for Eternal Life. Start drinking it. You know, drink 8 to 10 ounces a day, and it'll help keep you young, keep your nervous system good. It's good for the immune system, and we need all the help we can get. But it includes the acai berry extract, and you need to use at least 2,000 milligrams, and the resveratrol, the powerful component of the grapes, the dark grapes, that helps keep us young. In saying that too, it was fascinating. When I was first given this formula back in the late 90s, I was told I should do it. And guess what? I quit doing it. Like all of us, you know, we get busy in our life, we forget about things, and I think if I would have been taking that this entire time, I probably wouldn't have come down with the arteritis vasculitis like I came down with, because they dropped a really nasty mycoplasma on us through chemtrails, and that mycoplasma infection led to my pancreatitis, my spleen having problems, my organs, you know, having problems, and I probably could have avoided that had I kept taking this Elixir of Eternal Life. I mean, you know, I swear that infection put 10 years on my body within 6 months, which means I aged 10 years in 6 months. And I want to get that back. So I was praying, and that's when St. Germain came and said, you need to be taking this again. So I'll give you the recipe, and does anybody have any questions? Go ahead.
Can we get enough vitamin D down here just from being in the sun?
No. You have to be in Phoenix or further south to get adequate sunlight to give you adequate vitamin D. So if you live north of Phoenix, you better be taking a vitamin D supplement. Isn't that strange, you know? And even then, you know, all of us are putting sunscreen on to block the sun. That blocks us from making vitamin D. You know, the dermatologists are turning us into a bunch of vitamin D deficient nation. And they've actually found vitamin D protects you against skin cancers. So I love this stuff. I take it all the time. It tastes good, so that motivates me to take it, and it makes me feel better. It makes my immune system work better. So I like this form the best because it's not only got the vitamin D, but it has the K2, and it has it in a form and with the herbs that help you absorb these darn things. Because some of the problem is our guts aren't absorbing the vitamins like they need to, because we've got all these GMOs and other things that have caused changes in our gut. And then if we have yeast, we don't absorb them as well. And so there's a lot of reasons why we're deficient. And this bypasses those deficiency issues and gets the product into your cells and your system. So I love this product. It's probably my favorite form of vitamin D plus K2. You can take K2 by itself. This is the minoquinolone, the K2, and this is another type of K2, this is another type of K2, but I highly recommend people take it in a form that you get vitamin D and K2 because they're a good combination together. They work really good to get rid of vasculitis, arteritis, and all that stuff. So